Chapter 15, Alzheimer's disease and genetics. This is specific training for the Alzheimer's sensor, the genetic test. All right, let's talk about Alzheimer's disease. We find that in the case of Alzheimer's disease, we have a number of unfolded proteins. So proteins are built, but they're not folded correctly, they're not built correctly, and they tend to accumulate in the brain. However, it is still unclear if these unfolded proteins are the cause or an effect of a consequence of the disease. So it's still unclear what role they play. What we do know is that also free radicals, oxidative stress, tend to accumulate more in the brain, and they start to damage all types of systems. And this causes, among other reasons, areas of the brain to die off, and this causes memory loss and cognitive problems. Now, if you look at a normal person, a healthy person, from birth until death, you have a life expectancy of around 80 years. So that would be the normal life expectancy. And the disease progression of Alzheimer's disease is usually, on average, like this. For 60 years, you don't have a problem. Then the first symptoms occur. Then it takes around 5 years to get the correct diagnosis. Yes, you do suffer from Alzheimer's disease. And then it takes another 7 years until you then die prematurely of this disease, 72 years. Now, people say Alzheimer's disease is not treatable. There's no cure for Alzheimer's disease, and that is absolutely correct, still correct. There's a lot of research on it, there are a lot of promising therapies, so I don't think this will remain true for much longer, but currently this is still the case. However, and this is what makes it interesting for preventive genetic testing, there are lifestyle factors that have shown to influence the likelihood of development of the disease, as well as the onset of disease, when it happens. So lifestyle factors that we can control can influence the disease probability, also if it occurs earlier or later in life. And the risk factors are increased cholesterol, so blood fats that are increased are a risk factor, high blood pressure is a risk factor, having the disease diabetes type 2, and as I've said, also the free radicals are a big issue. The free radicals, those toxic molecules that are produced and that damage the brain. And the prevention by changing lifestyle factors has shown to increase or decrease the risk. So for example, if you exercise 3 times per week, you reduce your risk by 30%. If you have a lot of social contact, if you're in clubs, so you have a lot of contact to other people compared to you sitting at home and watching television all day, this also delays the onset and reduces the likelihood of the disease significantly. Smoking, again, is a risk factor for many diseases, not just lung cancer, also improves or speeds up Alzheimer's disease, so it should be avoided at all costs. Also, mentally challenging activities and high education has shown to be beneficial. So really, people with especially a high risk should train their brains rather than watching talk shows. They should do mentally challenging activities to keep their brains active and trained. The Mediterranean diet has shown to be beneficial for mental health, and a diet rich in antioxidants is also beneficial, which is not surprising since free radicals, they are the oxidative stress, and antioxidants with like vitamin C, E, alpha-lipoic acid, they are known to neutralize the free radicals. And scientific studies have also shown that drinking 2 to 5 cups of coffee reduces the risk by 64%. And that's also very likely due to antioxidants. Coffee has extremely many antioxidants, free radical inhibitors, and they help you decrease your risk by 64%. Additionally, antioxidants taken at higher dosages as a supplement are likely to improve the outcome and the onset. Now, while healthy life might be 80 years, and Alzheimer's disease, unchecked without prevention, might give you a lifespan of 72 years with 7 years of severe symptoms. Alzheimer's disease and prevention are likely to delay the onset and reduce the likelihood of the disease from developing. So you get 75 years of no problems, then some symptoms might develop, and then you've reached your 80 years lifespan without having even had the diagnosis. So really, while it is still untreatable when it has developed, there are lifestyle factors that reduce the likelihood and that delay the onset. And often 10 years later is completely sufficient because it's a disease that just occurs late on in life. All right, how about the genetics? There are 3 different versions of a certain gene, the ApoE gene. E2, which means it has certain genetic letters, gives you a protection against Alzheimer's disease. E3 gives you a normal risk of disease, and E4 gives you a predisposition to Alzheimer's disease, so a higher risk. So there's protective, normal, and higher risk versions. And Alzheimer's disease is a codominant inheritance. In case you don't know what that means, please do watch the inheritance of genetics training. It just means the more bad genes you have, the higher your risk is. So the different combinations, and every person has 2 copies of this gene. If you have 2 of the protective version, you have a 0.7-fold risk, so a lower risk than that of the general population. If you have E2 and E3, also 0.7. If you have E3 and E3, that's the general thing, about half the population has this, so normal risk. E2 and E4, it's a higher risk, 2.5. E3 and E4, 3.2, that's my personal risk. And E4 is a 15-fold risk. And this is complicated genetic statistics. This is not something I would usually communicate to a patient. This is how we show it in a report. So you can either have the average risk, that of the general population, you can have a protective effect or an increased risk. And depending on where the arrow is, you might have a lower risk, so this prevention is less important for this person, and if it's here, it's very important for this person. And this here is the gene. As I said, these are the different combinations that could be possible. 66% have no increased risk, 7% have protection, and an increasing number have higher risk. And this is the science behind it. All right, so that's the gene. And if we find out that you have an increased risk, we can create a specific prevention program that modifies your lifestyle, and this is all in the report. It's very easy to read what the preventive measures are. The diet is changed, you're encouraged to be mentally active and so on, so you can reduce the likelihood of the disease developing and delay the onset. And then, as I've said, there are also drugs that are commonly used for Alzheimer's disease. And please do watch the pharmacogenetics training for this. From there we know that a drug is metabolized by a certain gene or enzyme. And if this enzyme or gene is broken through a genetic variation, you might take this drug regularly, but it's not removed from the body. So it increases every time you take it. And that can then cause a significant increase in this drug in your bloodstream, and it eventually cause severe side effects. Or a drug might not even be activated by the body due to genetic variations. So what we can do is we test the relevant genes that are relevant for the drugs that are used in combination with Alzheimer's disease, and that then helps us to reduce or improve treatment because we get the right drugs, we avoid the ones that don't work or cause side effects, or we adapt them in the right dosage. And as I said, please do watch the pharmacogenetics training, and you will learn a lot more about how we can optimize the specific treatment. So this test really is recommended for people that don't have Alzheimer's disease yet, that want to delay it or reduce the likelihood of development if they have a high risk. And when they have developed it, it's also for improved treatment. So these are the 2 factors that are important, and it is recommended for healthy people as well as people that already have this disease. That's the end of chapter 50. Alzheimer's disease and genetics as training for the Alzheimer's Center.